When we were talking about A1C, we saw that the A1C value depends on blood glucose or blood sugar. We'll use the term blood glucose because that's a more appropriate term, even though blood glucose and blood sugar mean one and the same thing. Now, where does glucose come from in our blood? To understand that, we have to understand as to how our food is related to creating glucose for our body. The food we eat basically can be divided into four components: carbohydrate, protein, fat, and vitamins and minerals. Vitamins and minerals do not form a big part of the food by weight, so we will not talk about them. Out of the carbohydrate, protein, and fat, there are two components, one which can be digested and absorbed and the other which cannot be digested and absorbed. For example, the carbohydrate includes fibers. Fiber is a type of carbohydrate, but it cannot be digested and absorbed by our body, and so we will not talk about it. What we will talk about will be the components of the food that can be absorbed, that can be digested and absorbed in our body, that they can circulate in our body. Now, carbohydrates, common examples include potato, rice. Proteins, the common examples include meat, poultry, and for fats, the common examples include butter, ghee, margarine, cream. Now, as you will see, there are very few pure foods. So there are very few pure carbohydrates, a food which only contains carbohydrate, or very few pure fat foods or protein foods. Sugar is a pure carbohydrate food. Oil is a pure fat food. But most other foods that we see in our day-to-day life or that we eat contain more than one components of these types of foods that we talked about. So the grain has predominantly carbohydrates, but it also has protein. So when we are eating bread, we are not eating carbohydrates, we are eating proteins too. Similarly, meat has proteins predominantly, but it has fat too. So it is not a pure just protein diet. We can decrease the fat, but there is still fat. One thing about proteins, proteins come from two sources. One is animal sources, the other is non-animal sources. The animal source proteins include meat, fish, chicken, poultry. The non-animal source protein include pulses, legumes, lentils, and then there is something in between which includes milk, yogurt, and milk products. So proteins have a wide array of sources that's available, but again, most of these foods contain more than one type of component of food, as we talked in terms of carbohydrate, protein, and fat. That's important because the carbohydrate component of the food is broken down into units of glucose. It's broken down to glucose and is absorbed in our intestine, goes to our liver, and then ultimately goes into the circulation. So the carbohydrate breaks down to glucose, goes to the blood and circulates in blood as glucose. We will talk about what happens when the glucose is high, how it is kept in the normal range in a moment's time. But let's look at proteins and fats. Proteins are broken down to something called amino acids, and they are absorbed, and some are processed in the liver and then circulate in our blood as amino acids, and they go to muscle and other structures of the body to form proteins. Fats are broken down in our intestine, in our stomach and intestine, to something called monoglycerides, diglycerides, triglycerides, fatty acids and stuff like that, which goes in our liver, where it is reassembled, reprocessed and then circulates in our blood. And these fats that circulate in our blood ultimately go and deposit in fat stores in various parts of the body. There are fat stores in the skin. Just below the skin there is subcutaneous tissue, which is lost in older people, so their skin doesn't look so tight as in a young person. So there are a lot of stores of fat in our subcutaneous tissue. These fats are stored in some areas of muscle, around the muscles, also predominantly stored in the liver. So fat goes and deposits as fat in various parts of the body, including the skin and abdomen, in something called omentum, in liver and other parts of the body. Now let's talk about how the normal blood glucose level is maintained. Normal blood glucose level is below 100 mg/% in fasting state in a non-diabetic individual, and below 120 mg/% in a person who is not diabetic but has eaten some food. So after 2 hours the level will be below 120 mg/%. What happens when we eat food? The glucose levels start going up. Once the glucose levels start going up in the blood, something is released in the body called insulin. Insulin is a hormone which is produced in the upper part of our abdomen in an organ called pancreas. Pancreas lies just behind the stomach. So when the blood glucose levels go up, pancreas releases insulin. And what is the job of insulin? Insulin helps the glucose go from the blood into the cell. Our body consists of billions of cells. Our body, you can imagine, has various systems. Like there is a cardiovascular system, that is the heart and related arteries. There is a pulmonary system which has the lungs, the throat, the nose. There is a nervous system which has the brain, the spinal cord. There is a gastrointestinal system which has the stomach, the intestine, the colon, the liver, the pancreas. So our body has many systems. Each system is made up of something called organs. So liver is an organ, pancreas is an organ, kidney is an organ. These organs at a very microscopic level are made up of something called the cells. Cells are so tiny that this pinch of my skin will have millions of cells. So the cells form the building block of our body. To function, the cells need glucose, and we saw that when the glucose in the blood start going up, insulin is released, which moves the glucose from the blood into the cell, and then the cell can function properly. So our brain cells can think properly, or can think, our heart cell can continue to beat, our muscles can move, we can move our arms, our eyes can see. So all these cells to work need glucose. Glucose comes from carbohydrates, and when we eat carbohydrates in any form that can be digested and absorbed, the glucose levels go up, insulin is secreted, the glucose which was going up now moves into the cell, so the blood glucose levels fall again. And that is why 2 hours after eating food in a non-diabetic individual, the levels come down to below 120 milligram percent. After 1 hour, they were 140 milligram percent, 150 milligram percent, but after 2 hours, because the insulin pushed this glucose into the cell, the levels come down back to normal. Now, for any reason, if a person could not eat and the glucose levels start going down, and they are down significantly, we said normal is up to 70, so suppose they became 60 or 50, what happens that the body starts making new glucose, and this glucose is formed a little from protein, but most of it is formed from something called glycogen in our liver and from the fats in the body. Those people who have liver diseases, cirrhosis, who have been heavy drinkers, cannot take fasting very easily because their liver does not have enough glycogen, and these people can feel significant symptoms if they go hungry. So when the glucose was going down, the new glucose is formed from the glycogen, the fats and the proteins. Very little is formed from the proteins. The important glucose that is formed from the fats, there is an important point behind it, that if a lot of fat is converted to glucose, then a lot of acid is created. When the fat turns to glucose, some acid is created. When a lot of fat is converted to glucose, a lot of acid can be created, and this acid in the blood can cause nausea, vomiting, and if it is very high can cause problems with the beating of the heart and process of thinking. So acid in high levels can be dangerous to one's survival, and that is why very high acid levels coming from the fat converting to glucose is not a good idea. In diabetic patients whose diabetes is not well controlled, a lot of fat is converted to glucose, creating a lot of acid, and this is called diabetic ketoacidosis or DKA, and we will talk about that when we are talking complications of diabetes. Suffice it to say, the body tries to maintain the glucose in the normal range by any and every mean possible. Now what happens, what are the symptoms of when the sugar goes high and the sugar goes low? We have discussed these symptoms in detail. The symptoms for high blood sugar include excessive urination. What happens when the glucose is up to 180 milligram percent, the kidneys can reabsorb it and keep it within the body. Once the level crosses 180, the kidneys cannot hold that glucose anymore and it is lost from the kidneys, and since it cannot be passed as powder, it takes away a lot of water with it, causing lot of urine formation. So the first symptom of high blood sugars is excessive urination. Again, all these symptoms are very well explained and in detail in our presentation on symptoms of diabetes or high blood sugar. Because a lot of water is lost, there is a relative dehydration in the body, and the relative dehydration can cause dizziness because there is less volume in the blood now, and it makes the person thirsty, so the person drinks a lot of water or other liquids to quench the thirst. So the second symptom of high blood sugar is excessive thirst. High blood sugar levels are also associated with problems in vision because a part of our eye called the lens get dehydrated and changes its curvature because of the extra sugar which is there, and then the diabetic patient or the person who has high blood sugar cannot see very well. And again, for details, refer to the symptoms of diabetes part of our presentation in another DVD. High blood sugars also cause increased chances of getting infections like in the lung, in the urine, in the skin, in the vaginal area. Also, high blood sugars cause difficulty in healing, difficulty controlling infections, difficulty in healing from the smallest of cuts and wounds. So these are all the symptoms of high blood sugar. What happens if a patient's sugar is low or starts going low? We have discussed symptoms of low blood sugar in detail in the presentation called Low Blood Sugar, Its Significance, Identification and Right Correction. To summarize the symptoms of low blood sugar, the first one is the person feels hungry. That is a normal response. When the sugar starts going down, the person feels hungry. So there is feeling of hunger, there is feeling of hunger pains in the upper part of the abdomen. There is headache, there can be palpitation, sweating. These are other symptoms of low blood sugar. The person can lose the ability to think and properly, and then the person can appear confused. The person can be irritable, person may not be able to think straight, and all these are symptoms of low blood sugar. In an extreme case, there can be seizures, there can be loss of consciousness, and there can even be death if the sugar goes down significantly and stays down for a long time. A long time in terms of sugar can mean a few minutes. So depending on the significance of the fall, how bad the fall in sugar value is or the glucose value is, and how long it persisted, there can be various manifestations of the low blood sugar.